Good morning, ladies and gentlemen. On this momentous occasion of World Heart Day 2024, I am honored to welcome you to our program initiated by Medgate Today TV Digital. Today, we gather with a shared purpose to shine a light on the critical issue of cardiovascular health and take collective action against the world's leading cause of death, cardiovascular disease. Heart disease accounts for approximately 31% of all global mortality. Yet, this reality remains under-recognized. It's essential to understand that cardiovascular diseases are not solely a result of genetics. They are often influenced by lifestyle choices and a lack of awareness. Please join me in welcoming Dr. Ashok Seth, Padma Bhushan, Padma Shri, Interventional Cardiologist, Chairman at Fortis Escorts Heart Institute. Let's begin our discussion with a question that highlights importance of interventional cardiology. Dr. Seth, as you are an interventional cardiologist, could you please explain its role in the overall treatment of cardiovascular diseases?
So, interventional cardiology is a branch of cardiology where many treatment of heart disease, which used to be done by surgery in the past, can now be done without surgery. Now, we are not surgeons, we are cardiologists who then specialized in this field. By the way, interventional cardiology is a field which arose gradually 50 years ago by opening up blocked arteries with a balloon. So it is called angioplasty. In the 80s, when I trained in angioplasty, we used to open up, we were the first ones, say, where blocked arteries could be opened by a balloon without opening the heart up, without opening the chest up. Because prior to that, only open heart surgery, as one would say, had existed, which is opening the chest and really putting grafts on the heart. But once we started opening up blocked arteries in the cath lab, in a conscious patient, by going through the arteries of the groin and getting into the heart arteries, this field gradually became much better because it was crude in those days, and over the last 30 years has grown as the mainstay of treatment of heart disease and blocked arteries and prevention of heart attacks, treatment of heart attacks, treatment of angina. In fact, as you know, coronary artery disease or heart attacks is the biggest killer. Well, the mainstay of treatment of blocked arteries these days is interventional cardiology. And interventional cardiology has grown and refined itself to be a safe, simplified procedure done in cath lab. Conscious patients open up multiple blocked arteries, even in sick patients, has also grown into treating valves of the heart without surgery. In conscious patients, has grown into treating multiple aspects of structural treatment of heart disease, and thereby leading to a discharge of the patient in 1 or 2 days, walking around with a safety which is greater than ever seen before, of more than 99% to 99.5%. So interventional cardiology has now become the established field of specialization in cardiology. And we are not surgeons, we are cardiologists who are able to do techniques and technology which is replacing surgery through minimally invasive methodologies in a very safe environment in cath labs rather than theaters, and patients' recovery is faster and mobilization is faster. But by the way, science has progressed to be complementary. I don't think we're talking about surgery or angioplasty or interventional cardiology. We are saying these are various, and we need every tool at various times to treat a patient with heart disease.
Thank you for providing a great explanation on interventional cardiology. Thank you for joining us in this vital mission. Happy World Heart Day, everyone. Stay tuned and do subscribe our YouTube channel.